You are listening to Pharmacy IT and Me, your informatics pharmacist podcast. Today is March 1st, 2019, and welcome to another episode of Last Week in Health IT. As with every episode, we start off this one stating that the intended audience for this episode is everybody. February flew by pretty fast, and we're heading into the month of March now. So let's get started with going over some of the news items from the last week. So the first news item is the NHS is getting rid of outdated gadgets by the end of 2021. So the NHS stands for the National Health Service, and they exist in various areas in the United Kingdom. They have stated that they will be phasing out any kind of technology that's considered outdated by the year of 2021. These actually include fax machines and pagers, and quite honestly, it is promising that they are moving towards using more advanced technology for communication between healthcare providers. The way they are doing this is by basically preventing the purchase of outdated technologies so that it can be phased out. So, for example, this past December, they did this by not allowing the purchase of fax machines. So what do I think about this? I actually think it's a good sign to have some governance that pushes everybody to move forward in a standardized way. So in the United States, most of us are aware that our healthcare system is very fragmented. But when looking at the technology, healthcare IT is also fragmented. This includes any communication devices as well. So for example, a significant number of organizations still use fax systems and pagers. Using outdated technology that was never meant for interoperability will keep holding us back, and newer technologies that have standards built in and encryption built in can usher us forward, but it will only happen if everyone agrees to use it. So the next news item is Microsoft and Philips partner up for augmented reality surgery applications. So Microsoft, they recently announced a partnership with Philips to use the Philips application Azurion with the Microsoft HoloLens 2 for AR-based surgery. So this has some promise. Think of it like if you are working on a surgery, but you have an extra imaging information in your view, kind of like wearing an Iron Man helmet view if you want to compare it to something in pop culture. So not only that, but the platform they are working on seems to be compatible with eye tracking, gestures, voice recognition, and other little traits like that make the best use of this technology for better surgery practices. Alright, so the next news item is Medicaid and rural data has been added to the CMS opioid prescribing mapping tool. So about 3 years ago, the CMS launched a tool that would help in mapping out the opioid prescriptions in the United States. And the purpose of this tool was to combat the really, really difficult opioid crisis that is facing the nation right now. And this was through informing people who use the tool to help with its prevention and treatment. So one of the biggest areas of the opioid crisis has been in the rural communities. So it's really great to see that CMS has finally been able to add in Medicaid and rural data for that tool. And having this data allows for better analyses and contribution to improvement of public health. Alright, so the next item is machine learning algorithms have been used by Google and Verily to screen for diabetic retinopathy in India. So Alphabet, the parent company of Google, they have another division for life sciences, and that's called Verily. So Google and Verily have teamed up, and they're using a machine learning algorithm for screening of diabetic retinopathy, and this is being done in India. So this becomes an important step forward in providing healthcare in areas where there's a lack of providers or a shortage of providers. So should machine learning and AI be successful in these type of screenings, we may be looking at a great future for the underserved communities because AI will be able to fill the gap of provider shortages to deliver some sort of patient care and preventative healthcare to local patients. Alright, and the last news item I have is about the Medical Genome Initiative. So the Medical Genome Initiative consists of 8 healthcare and research organizations in the US and Canada, and its launch has been recently announced. The reason why this is important in terms of healthcare IT is that the top areas of focus will be clinical utility measures, data infrastructure, and data sharing. And the mission of this initiative is to expand access to high-quality whole genome sequencing for diagnosis of genetic diseases through the publication of common laboratory and clinical best practices. Members of this initiative include Baylor Genetics, Broad Institute, Illumina, Hudson Alpha, Mayo Clinic, Rady Children's, Sick Kids, and Stanford University. And alright, before we go, if you'd like to hear more news about healthcare IT, you can check out great curated articles at www.healthcareitnews.com. It's actually where I go for daily healthcare IT news to keep myself updated on what's going on in that world. And alright, if you like this episode, you guys can subscribe and rate us on iTunes, Stitcher, Google Play, or any of your other favorite podcasting services. You can also follow us on social media on Twitter or Facebook at PharmacyITme, or our Instagram at PharmacyInformatics. Or you can also email us at pharmacyitme@gmail.com. And you can also follow me on my personal Twitter account at TonyDowPharmD. And also, I wanted to plug a great networking opportunity called Pharmacists Connect. If you are familiar with Slack Workspace, think of it as a Pharmacists Connect as a large vetted one through the Slack Workspaces. I've actually met some really great colleagues on it, and there's even an informatics space within it as well. You can find out more by visiting pharmacistsconnect.com, which is PharmacistSconnect.com. Thank you again for listening, and I'll see you on the next episode of Pharmacy IT and Me. And remember, technology is a tool, patient care is the goal.